Hello, my name is Dr. Angie Wen, and I am an assistant professor of ophthalmology at the New York Eye and Ear Infirmary of Mount Sinai. Today I'm going to speak to you about what you need to know about the aging eye. Many people experience vision changes or a decrease in vision as they age. Often these changes can be treated, corrected, or reversed. In addition, many age-related diseases and conditions can only be detected by a thorough eye exam. It's important to detect these conditions early in order to have the best chance of treating them appropriately. Because of this, we recommend that everyone over the age of 50 have a comprehensive dilated eye examination yearly by an ophthalmologist. An ophthalmologist is an IMD, a medical doctor specializing in eyes. One of the changes that everyone notices with aging is presbyopia, or the need for reading glasses. Around the age of 40 or 45, you will experience a loss of ability to see at near and find it difficult to read newspaper or work at the computer, even if you already have glasses for nearsightedness or farsightedness. This difficulty seeing up close begins gradually around age 40 and progresses until the age of 60 or 65. For many years, the only way to deal with presbyopia was to obtain bifocal or progressive glasses, where the top portion of the lens would help you see far away or at distance, and the bottom portion of the lens would help you see up close. If you did not wear glasses prior, you could use over-the-counter reading glasses such as are commonly available at pharmacies. Now we have several new technologies and methods for dealing with presbyopia. One such option is multifocal contact lenses, which are contact lenses that allow you to see well at all distances. Another is monovision LASIK, in which a laser is used to treat one eye so that it sees well at distance, and the other eye to see well at near. Finally, you can have a special implant, such as the one shown in the bottom right image on the slide, placed in your eye during cataract surgery that will improve vision at all distances. Cataract is another common condition that occurs with aging. It's a clouding of the natural lens within the eye. Cataract development is related to UV light exposure, which can come from the sun, as well as diabetes, smoking, and advanced age. The images show different patterns of clouding and opacity that can occur in the lens. Fortunately, cataract is a reversible cause of vision loss. If you are diagnosed with cataract, you can have cataract surgery to remove that opacified lens. It's currently the most commonly performed surgery in the U.S. and is generally very successful at restoring vision that is lost from cataract. A very small incision, less than 3 millimeters wide, is made on the side of the eye. The cataract is gently removed with ultrasound, and then a new lens implant is put in place of the old lens. This new implant helps the eye to focus and can reduce the need for glasses after surgery. In the left image, you can see the cloudy lens or cataract. After the removal of cataract, the implant shown in the middle image is put in its place, and the rightmost image shows the implant in place. This implant allows the eye to focus and to see clearly once again. Glaucoma is another eye disease commonly associated with the elderly. It usually occurs in the 6th or 7th decade of life, but can also affect babies, children, and young adults as well. Glaucoma is a disease in which the high eye pressure damages the optic nerve and causes loss of side vision. If uncontrolled, the loss of side vision will progress until eventually central vision is also affected. The left image shows a healthy optic nerve, and the right image shows an enlarged optic nerve center, which is typical of glaucomatous damage. The most common type of glaucoma, called open-angle glaucoma, is typically painless. Many patients can have early glaucoma without any symptoms, and thus glaucoma is often called the silent thief of vision. Unfortunately, glaucoma is a cause of irreversible vision loss. While we are able to prevent progression of glaucoma if it's detected early enough, currently there's no way to recover vision that is lost due to glaucoma. Thus, it is extremely important to have a routine annual eye exam so that any sign of glaucoma can be detected as soon as possible. Initially, glaucoma causes loss of side vision. This can result in difficulty driving, especially when attempting to pass other cars or when changing lanes. It can also make it dangerous to cross the street, as the loss of peripheral vision may make you feel as if people are sneaking up on you from the side. If allowed to advance, glaucoma can eventually result in profound loss of central vision as well. Your ophthalmologist may perform a visual field to see if you have vision loss from glaucoma. This is a test that tests specific points in your side vision. Areas which have been affected by glaucoma appear as dark spots on the test. There's a special type of glaucoma called angle closure glaucoma that affects a smaller percentage of people. The angle is the area formed by the cornea and the iris, and it is the entrance to the drain of the eye. The eye is filled with fluid, and this fluid is filtered daily through the drain. If the angle suddenly narrows, the drain will become blocked, and the pressure inside the eye can rise very rapidly and cause painful, immediate, and possibly permanent vision loss. Persons of Asian American descent or those who take certain types of medication are more prone to angle closure. Fortunately, there is a simple laser procedure that can create an alternative drainage hole in the iris. This will prevent pressure rise from angle closure in people who are susceptible. It's important to have a special mirror exam with your ophthalmologist to determine if you are at risk for angle closure glaucoma. Diabetes is a systemic disease that affects a large part of our U.S. population and can also have a big impact on eyes. Diabetes affects 11.3% of Americans over the age of 20 and over a quarter of the U.S. population over age 65. Between 40 to 45% of Americans who are diagnosed with diabetes will have some stage of diabetic eye disease. Diabetes can cause blood vessels in the eyes to leak and function poorly, causing bleeding and abnormal swelling in the eye, as shown in these images. Early stages of diabetic retinopathy can develop without symptoms, and thus it's important to have a comprehensive dilated eye exam at least annually if you're diabetic. Prompt treatment can prevent permanent damage and even reverse certain types of vision loss from diabetes. Macular degeneration is a disease that preferentially affects the center of vision. It tends to develop during the 6th or 7th decade of life. There are two different types, dry and wet. High-dose antioxidant vitamins can help slow the progression of dry macular degeneration. Abnormal bleeding and swelling of the retina occur in the wet form. There are many new medications on the market that can now help reverse the vision loss caused by wet macular degeneration. In summary, regular comprehensive and complete eye exams by an ophthalmologist or an IMD are very important. They can help catch many of the eye diseases in their early stages so that they can be treated appropriately. If you have further questions regarding your eye health, please contact your local ophthalmologist. I hope this presentation has been both helpful and informative.